So the life plan community environment, really allows folks to be within a community no matter what level of care they are.
So we often have couples and they don't age at the same pace necessarily. One of them may have an illness or something going on, a progression of disease that requires a higher level of care. One individual from the couple will move to health care.
It's made it so much easier for both of them. I mean, Dad could come over here on his scooter and they could eat dinner together. They could be together, but then they had the separate care that my dad needed.
And at times, they can also move on to a skilled care setting.
You can go and be cared for as far as long-term care services and support without having to move anywhere. It's all here.
When residents here at Wellspring reach a point where they consider moving from one level of care to another, some have a fear that they'll be isolated and that their environment will change. But they really find that they can still move back and forth and see their friends, socialize, participate in activities, throughout all of Wellspring. And that's just something they really enjoy.
Well, I think Wellspring has a very home-like environment and personalizable environment. So when residents move, they bring the things that are important to them with them, whether it's grandfather clock that's been in the family for 50 years, their own furnishings, all of those kind of things. So they bring that with them and they can set it up so that it is home again.
There's a great falsehood out there that once you move to an area of a campus of a continuing care retirement community, a life plan community like Wellspring, that you can't go back and enjoy the amenities, what we again term independent living. And that is a complete falsehood, and in fact, rubs completely against the mission here at Wellspring.
Well, when they made the decision to come to wonderful Wellspring, we as a family, as did they, had hopes that they would be together in independent living. But with the help of the Wellspring team, the professionals, the very caring professionals, they helped open our eyes up as a family that really would not be possible. And that my mom needed to be in healthcare and Bob, my stepdad, could be in independent living. And it really was interesting because I think as a family member, they want to be together. You want them to be together, but sometimes the emotional and physical challenges of them being in independent living just doesn't work. And truly, Wellspring helped us look more objectively at the situation, and my mom's in healthcare and Bob's in independent living, and it's working out great.
Hello, my name is Geriatric. Welcome to Wellspring. People are most familiar with our independent living and our wonderful amenities, but today I'd like to tour you around our healthcare areas, which include assisted living, skilled nursing, memory support, and rehab. Come on in. In assisted living, the independence of our residents is complemented by the little bit of help they need day to day with their activities of daily living. A special dining room is provided, as well as several amenity spaces, including our Richardson Auditorium and this beautiful courtyard.
We cover the full continuum of care needs. So once someone is no longer independent, a lot of times they're needing some assistance that could be provided at an assisted living level, and that's things like medication management, good nutrition with 3 meals a day, assistance with a shower, with dressing, things like that. They can do partially, but they need some minor assistance with.
Residents in assisted living have access to our entire campus, including our resident activity center, our wonderful dining facilities, and the aquatic and fitness center. Private rooms in assisted living encourage residents to bring personal touches from home, as well as providing a safe and comfortable home-like environment.
Yeah, so when residents move to assisted living, the good thing there is, they may be needing some daily contact, but they still have all the opportunities to enjoy independent living.
My mother, she would get around by herself, so she still would go to the dining room, still interact with her friends.
There is always somebody there to take care of me. It's much easier living for me. I don't have to cook, I don't have to do my laundry, I don't have to worry about my medication.
She would have that extra care, the nurses and people that, you know, would look in on her all the time, which never could have happened if she were living independently.
It really is convenient and very helpful to them because they can have the extra services but also enjoy all those things that they've been enjoying in independent living prior to their move.
So now I'd like to take you into Sycamore Square, our skilled nursing area. Sycamore Square is the highest level of health care offered at Wellspring. Our professional medical staff provides top-notch clinical services in this warm, inviting, home-like environment. Residents enjoy private rooms that are personally decorated to help them feel at home while receiving top-notch services.
You know, in Sycamore Square, residents who have medical needs have nursing attention 24 hours a day. If there's somebody who has a very specific medical situation, something that needs monitored regularly, and a nurse to monitor and keep up with, that's the best place for them because the nurses are there 24 hours a day, but also still enjoy the other things that the environment offers and that the community offers.
My dad, you know, with all the issues that go along with a stroke, he did need more care because, you know, things just weren't working out, and so skilled care was a godsend. It was excellent, an excellent place, and that was great. That was an answered prayer because they were able to help him with, you know, some daily tasks that he could still feel independent, but yet, you know, had the peace of mind that, you know, he had help with the other areas that he needed. And everyone over there in skilled care was just fantastic. They, you know, are just so kind, so, you know, caring, and, you know, have always treated him with the highest respect, and, you know, and just, they've just done great. They've become like a family.
Residents can enjoy all of the amenities that Wellspring has to offer, but there are special things featured in Sycamore Square, such as a full-time activities staff, wonderful auditorium space, and a special dining program where their individual needs and desires can be met. Welcome to Willow Way, our memory support area, where our residents enjoy full and enriching life in a safe and therapeutic environment. Our residents live in private rooms where we encourage them to bring items from home that make it more comfortable and desirable.
In Willow Way, which is our memory support unit, the staff there have special dementia training. So they are very skilled and adept at handling some of the things that we might see. Sometimes there are behaviors that come out with dementia. If someone is a wanderer, the Willow Way area is perfect because it's kind of like a wheel and spokes on a wheel. They can always end up back in the middle where everybody is, around all the other folks.
And so a transition from one level of care to another here at Wellspring is so much easier.
Our enhanced activity and exercise program stimulates residents in many of our common areas, which include a wonderful outside patio, living rooms, a wonderful dining room where they can enjoy company by family and friends alike. Residents who have recently had surgery or experienced an acute illness find great benefit in our rehab area. Rehab is a short-term area where residents are under 24/7 care by our expert nursing staff who coordinate with the resident's physician as well as any discharge planning. Conveniently located on campus, residents can have visitors and family members come as often as they are able. Our expert nursing staff is providing a skilled level of care to help the resident recuperate and regain their strength.
So our rehab unit is for temporary stays. for independent and assisted living residents who are having either a medical situation, a spell of illness, an acute situation. They may have had some surgery or been to the hospital for some reason, or they might just be under the weather, a little dehydrated, or have the flu or something. And so the rehab unit is perfect for those situations. It's a small unit, it's only 10 rooms. And we staff it pretty heavily depending on the level of care needed at the time. But it's a great environment because, you know, the residents, it's very homey, much more inviting than a hospital situation.
Life would have been really challenging because Dad would have been in one place, Mom would have been in another place. Once Dad was able to come here to rehab, my mom obviously could go over and easily see him. And about a year after he got ill, she started having some issues with mobility and some other health issues, and so it's just been a blessing. Dad had his scooter, he could come over and see Mom, and so it's having them both here in the same place is just really wonderful.
I had surgery and I was here almost 4 weeks, and I couldn't have had any better care or caring. The people were wonderful. When I had rehab while I was there, Rob came, which was good. And we had dinner at the end. We could go out and sit where the table was and had dinner with 2 patients that were there, which that was nice after that long a time. So it was, you were there, but it was more like being at home, I guess. They came during the day to bring me things to do, talk to me. They'd come at night when they'd have a time. And it really made the time pass so much faster than if you just laid there with no one.
I would say all pros. They can see each other any time of day, all day, part of the day. They can share meals together. They can do activities together. And yet they have the support of, I'll call it the Wellspring Village, particularly my mom, who needs some nursing care and help, and a lot of help getting dressed and really, you know, functioning throughout the day. And without that option, it would have been impossible for my stepdad to take care of her, even with home care help.
Well, some of the great things about care here at Wellspring, the nursing staff, the therapists, the doctors, the nurse practitioners, everyone communicates. So we develop a care plan for a resident that's really well orchestrated.
Let's face it though, none of us want to be either partially or fully dependent upon someone else. Once they work through those emotions and that short-term hesitancy, everyone usually comes to the understanding that it's actually in their best interest, just like the move initially to Wellspring was.
It was a full life, I think is best it could have been. Having a place like Wellspring where you know that they're going to be taken care of, they have professionals who deal with this day in and day out. It certainly is not a burden on your family anymore the way it would be otherwise.
Being a nurse, being a healthcare executive for many years, and the culture is something I pay a lot of attention to, and that's palpable to me here.
Lots of CCRCs out there, but knowing Wellspring was not just a CCRC, but caring, loving, professional, just top-notch. It was hands down the choice to be made.
So one of my favorite things about the healthcare system here at Wellspring is it's really a person-centered approach to care. So we pay very close attention to the residents' needs and wants.
The peace of mind that having my dad in skilled care at Wellspring is tremendous. Just knowing, you know, that he is in a safe, caring, loving environment, and he's treated with the highest levels of respect, and you know, from everybody, whether it's a CNA or a dining or the nurses, and the peace of mind to me is just priceless and a tremendous blessing.